All right. Good morning, everyone. Thank you so much for those of you who were able to join us this morning. We really appreciate you being here and hope that this is a great information session for you. I just want to remind you that this is going to be recorded. So if it's something you want to reference back to, we'll be able to send it to you, as well as anybody if in your organization that wanted to attend but couldn't, we'd be happy to share this out once it's complete. Compassion and Choices is getting ready for our 2018 campaign to see what we're going to be doing, how we're going to be doing it, and we wanted to give you all an update about how we've done this past summer throughout the fall, and let you know what you can be doing to get involved and help us. So again, this is a recorded webinar, and if you have any questions, please feel free to type them in the chat box. I'll be checking that to see and answer any questions that you have, as well as you can unmute yourself and ask the question as well. So let's go ahead and get started, Corinne.
Sure, Amanda, why don't you, did you introduce yourself and let people know who you were?
I apologize. I am Amanda Kavanaugh. I am the campaign organizer here in New York. I have been with Compassion and Choices pretty much since the beginning of the start of the New York campaign. I started as a volunteer, and now I am working closely with Corinne here in New York with all of our volunteers and supporters to keep pushing our legislation.
Great, thanks, Amanda, and thank you everyone for joining us this morning. It sounds like we got a few more clicks, but you should know that some of our supporters couldn't join us this morning, so as a reminder, we're taping this webinar. If there are questions that you want to ask offline, don't hesitate to get in touch with us. You have our contact information, but it will appear again at the end of the presentation. So good morning. This is our agenda for this morning's call. We're going to go over what the status is of the legislation for those of you who are relatively new to our campaign. We'll go into a little bit of detail about what the bill would do and what the safeguards are. We'll then talk about who our supporters are in a number of different categories so that you get a sense of the strength of our campaign. We'll turn our attention to who our opposition is and what some of their main arguments are and which of those arguments resonate the most with lawmakers. We want to touch a bit on what the impact of the New York State Court of Appeals decision is and has been on our campaign, and how we expect that decision to affect our campaign in 2018. Then we're going to talk about what to expect from lawmakers, from the opposition, and from Compassion and Choices in 2018. And lastly, we'll turn to what your organization can do to help us authorize medical aid in dying here in New York State. We have, I think, 24 suggestions for ways that you and your organization can get more involved. So let's get right to it. Amanda and I will be switching off, but I'm going to start here with what the status is of the New York legislation. So the Medical Aid in Dying Act, in brief, is a bill that would allow a terminally ill, mentally capable adult to ask and receive from their doctor a prescription for medication that they can take to bring about death at a time of their choosing to avoid suffering, so long as they can self-administer the medication. The legislation includes over a dozen safeguards to ensure patient autonomy, and it's modeled after Oregon's Death with Dignity Act, which was first passed by voter referendum in 1994. It also follows closely the laws that have been adopted by 5 other states, plus the District of Columbia, all of whom now authorize medical aid in dying. I'm going to go over these safeguards. I may not read all of them. You'll have this PowerPoint to refer to in the future, but we also have a nifty one-page fact sheet that lists what the bill would do and what the safeguards are, and we can certainly send you that if you think it would be helpful in your efforts. But just to go over a few, the bill makes clear that the patient must be able to take the medication themselves. Only those with an incurable and irreversible terminal illness and a 6-month prognosis are eligible. The attending physician has to inform the patient of all of their end-of-life care options, including hospice and pain and symptom management. If either doctor has a concern about the patient's mental capacity, they must refer that patient to a mental health evaluation. And 2 separate requests for the medication have to be made, one oral and one written. And the written request has to be witnessed by 2 people. Prescribing doctors have to comply with medical record documentation requirements and make those records available to the State Department of Health. Those providers that comply with the law have civil and criminal immunity, so long as they comply with all of the aspects of the law. Anyone attempting to coerce a patient is subject to already existing criminal statutes under New York law. A terminally ill person can withdraw their request, not take the medication, or change their mind at any point. And life insurance payments can't be denied to families of those who use the law because they use the law. Just a few more here. No physician, health provider, or pharmacist is required to participate. Unused medication has to be disposed of according to existing legal requirements. The State Department of Health is required to issue a publicly available annual report, and the underlying illness is listed as the cause of death on the death certificate. So that is, in brief, what the bill's safeguards are. In terms of where we are, as you probably know, the bill in its current form has been introduced in both houses, in the Assembly and the Senate. An earlier version of the bill passed the Assembly Health Committee on May 23rd in a vote of 14 to 11. That's the Assembly Health Committee. It's a progressive group, but as you can tell by the vote, it was not an overwhelming positive vote, and we continue to face challenges with the bill in the Health Committee. An amended version of this bill is likely to be introduced before January of 2018, and it will need to once again pass the Assembly and Codes the Assembly Health Committee and the Codes Committee, as well as the Senate Health Committee and the Codes Committee before going to the floor in each of the respective houses. The reason it has to go through the Assembly Health Committee, again, most of you probably know, is because we are in the middle of a 2-year cycle. So when the bill passed the Assembly Health Committee in 2015, that was in the 2nd year of the last legislative cycle. So the bill has not yet, this cycle, passed through the Assembly Health Committee. That is what we're looking forward to in 2018. Amanda, do we have any questions at this point?
No.
Okay. So I mentioned that it is likely that an amended bill would be introduced before January of 2018. And although we don't have that amended version right now, I can just give you a sense that there are 3 categories of expected changes. As we learn more from all the states that have authorized medical aid in dying, and as we get feedback from statewide stakeholders and lawmakers, we've been working with the sponsors on tightening some of the definitions in the bill, looking at whether additional safeguards are necessary and smart, whether those safeguards would impede access to aid in dying, and also clarifying the bill before it sort of moves into its final shape. So just in general, we're looking at probably a modification of the definition of terminal illness. As I said earlier, the condition must be incurable and irreversible, and I think that those words are not in the current bill, but they are words that we're looking at along with the sponsors for the new amended bill. There's been some work done with a number of statewide stakeholders on the witness and interpreter provisions, so cleaning up some of that language to make sure that interpreters are qualified and that interpreters are available to people who want to access medical aid in dying. And then finally, there was some confusion in an earlier version of the bill about whether the report of the mental health professional had to be shared with only one physician, the requesting physician, or with both physicians. And I think the new language will make clear that any physician that's involved in this process will have access to the report of a mental health professional if such report is generated. So I know this is a little bit down in the weeds, but I just wanted to give you a sense of the scope of what bill amendments that we might be looking at. Nothing in what I've heard would alter the core provisions of the bill or the core safeguards in the bill. So I think we're looking at relatively minor amendments that address some new things that we know about implementation, and also just generally cleaning up language issues. Does anyone have any questions about this at this point?
I do not see any questions in the chat box. Folks, if you want to ask a question, you can certainly type it there or unmute yourself and ask. All right, Corinne, I think we're good.
Okay, so Amanda, I'm going to turn it over to you.
Okay, one question first. Gail wants to know, Assemblymember Cahill spoke about having a sponsor change or a bill to the study bill. Do you want to talk about that briefly?
There are some members of the legislature that think that this issue needs study. What I would say, and what I think the advocates and sponsors would say, is that we've had 2 decades of experience with medical aid in dying in states that have authorized it. We're learning a tremendous amount from reports out of California. And any questions that remain about this bill and how it would be implemented in New York would be best addressed through public hearings. A study bill would only, it's my belief that a study bill is being considered by people who want to make sure that this bill doesn't pass. I don't know. I'm wondering if anyone else has anything to say. Maybe David Levin, if anyone wants to say anything else about that. But that's my feeling. We haven't seen a study bill yet, but in general, in the legislature, when someone proposes to study an issue, it means that they want to delay the process or block passage of the substantive bill itself. Anything else about that? I'm hoping that I'm not sure if that was a satisfactory answer, Gail, but I hope it is.
Corinne, I'm sure you can see the chat box. Gail agrees. She just wanted to mention that it was talked about during a meeting.
Yeah, I can't see the chat box, so I'm relying on you. But,
Okay.
But great. I think you should go on if there are no other questions.
Perfect. There are no other questions. So I'm going to move forward. Before I do so, I just wanted to mention that this PowerPoint presentation today is specifically for our organizations and our supporters, and kind of a high level thing. So of course there are more safeguards. We do have an advocacy training that really gets into the weeds about answering tough questions and different things such as that. But right now we just wanted to sort of update you guys and go over things on a higher level. So if you have additional questions, we do have tons of other resources. Corinne will be mentioning those a little bit later in the presentation. And we are going to be hosting an advocacy training on December 7th in Brooklyn that we can certainly get that information out to you if you're interested in joining us for that. So who are our supporters of the Medical Aid in Dying Act? Support for medical aid in dying has come from organizations such as yourselves, the Secular Coalition of America, the New York chapter, Voters for Change in the Adirondacks, ACT UP New York, Mobilizing Preachers and Communities. Reverend Johnny Green has been really powerful within our movement. The Rochester Breast Cancer Coalition, Statewide Senior Action Council, Housing Works, Harlem United, End of Life Choices New York. And most recently, these last few have come on throughout the summer, and we're really excited to have these folks. The New York State Public Health Association, the New York Civil Liberties Union, the New York Society for Ethical Culture, and New York State Academy of Family Physicians, who were one of the first groups to come out as neutral. And within these past few months, they took another vote and decided to change their position from neutral to in favor. And they're really beginning to help us and support us throughout our campaign.
Amanda, if I could add and clarify something, you'll see that the title of this slide is Support for Medical Aid in Dying. These groups have not come out in support of the bill yet. In fact, we don't have any memos of support from groups. And so this is something that we're going to be talking about later in the presentation. But once a bill gets placed on a health committee agenda, or even before that, what we're going to be looking for is for organizations that support medical aid in dying to actually support this bill and let lawmakers know that this bill is something that they endorse. So I just wanted to make that distinction and show you how important it is for the organization to now register your support beyond allowing us to, to mention that you support medical aid in dying. Now is the time to let lawmakers know that you endorse the bill. Amanda, do you want to take this one?
Yeah, sure. So support for the Medical Aid in Dying Act, as we know, is very high. We had a poll done in 2015 by Eagle Point Strategies that showed 77% of New Yorkers out of the gate support this issue. When they were educated further about what the bill is and does, that number rose to 81%. We have had 61,750 supporters sign online in New York, whether that be a petition or take some type of action online. When our campaign traveled to the New York State Fair this year, we asked for folks to sign a petition that read, "I'm a New Yorker who attended the Great New York State Fair, and I believe that terminally ill, mentally capable adults should have the right to request and receive medication that they can take to achieve a peaceful death." 7,784 people who attended the state fair signed that petition. Not sure if you've ever been to the state fair, but you can imagine that it's not easy to get people to talk about such a tough subject in the middle of such a happy thing. And this year we weren't even in the health building. We had been placed in a building where we were across from a jewelry cleaner and next door to a Botox station. I mean, we were way out of our element where we were placed, and still we were able to collect that many petition signatures and talk to quite a bit of folks about our campaign. And it was truly wonderful and powerful to talk to that many people. And we were able to deliver those petition signatures to the Governor's Council last month. Thus far in our campaign, we have 5 regional groups in New York State. They're action teams in the lower Hudson Valley, Long Island, the Catskills, the North Country. We are partnered with Death with Dignity Albany, a group here in the Capital Region, and we have teams that are developing in Western New York City, and Ithaca. So we started out with just a small number of people in these areas, and our teams continuously grow. And we are seeing more and more spaces pop up asking for presentations and groups and folks that would like to be involved.
Great. Thanks, Amanda. So now that we know who supports us, who opposes this legislation?
Before we do that, Corinne, we just have a couple questions. Would you like to get endorsements from atheist groups, or do you think that would be counterproductive?
I don't think it's counterproductive, but I do think that they're not going to be the groups that we that we highlight when we talk to lawmakers about our support. I mean, what happened here? Oh, you're seeing my calendar update. Sorry about that. Help. Yeah, so they, I think any group, particularly if that group has numbers, and that group is willing to, let their members know that they need to weigh in with individual lawmakers, I think it's helpful.
And are you interested in endorsements from humanist groups? Have we approached the SHSNY or Central New York humanist groups?
Not the Central New York one. We've done presentations for humanists in other parts of the state, but they haven't, maybe we haven't asked, but they haven't formally endorsed the legislation. Again, for groups like that, I think the questioner understands the optics of the situation, and because our main opposition, as you'll see from the coming slide, is faith, is the New York State Catholic Conference, honestly, painting a picture that people of faith are against this, which is not true. I think that to highlight the humanist and atheist support kind of exacerbates that, but certainly those groups can be supportive in helping their members get involved, and we would add those groups to the list of endorsers. But I think it's obvious that emphasizing groups that have more of a statewide reach and that aren't about religion are probably that's probably the route we would go. Does that make sense?
Yes. And then the last question, Corinne, is how are the organizations who are supportive informed about where presentations are being held so they can invite their members?
They're not really. Every once in a while, I think Amanda and I reach out to let people know, but we need to formalize that more. And I think this webinar is the first step in doing that. We realize now we have a critical mass of supportive organizations. We need to start organizing and making sure that you're all aware of what we're doing and let you know. And so later on in the presentation, you'll see some of our upcoming events. And I believe that Amanda from now on is going to be sharing those events with all of you from now on, and we'll probably do more of these meetings in the future to keep you updated as progress continues.
All right, go ahead.
Okay, so we've talked about support. Let's talk about the opposition. It will come as no surprise to you that the New York State Catholic Conference is one of our, if not our major opponent, one of our major opponents. We'll talk about this in a second, but you won't really see much of that because they have recognized that religious arguments are not really working here in New York. So what we've seen here in Albany is that the New York State Catholic Conference is partnering with other groups that are presenting themselves as the opposition. And so the New York State Catholic Conference, New Yorkers for Constitutional Freedoms, some of the same folks that you've seen active on reproductive health issues in Albany are the ones that are really behind much of the opposition here in New York. We also have formidable opposition in the Center for Disability Rights and Not Dead Yet. Sometimes Not Dead Yet operates under the umbrella of the Center for Disability Rights, but they're definitely allied organizations. There's also something called the Patients' Rights Action Council. They are a national group, but they've been very active here in New York. The New York Association on Independent Living has taken a position against this bill, but I just want to mention here that not all people who work in independent living and not all of the centers for independent living are opposed. And so we've been working to tease that out a little bit. But formally in opposition is NIAL, the New York Association. Then there's a coalition group that has formed that encompasses all of these groups, and it is called the New York Alliance Against Assisted Suicide. And so sometimes there are fact sheets or events in Albany that are sponsored by the New York Alliance Against Assisted Suicide, which is comprised of the groups above. So these are our opponents, and as we'll see in a coming slide, they are, I think, learning a lot from states that have prevailed on this issue, and they're stepping up their game here in New York. I just want to go over in brief what some of our opponents' arguments are. And while I'm not going to have time on this call to go through what all of the responses are, I want you to know that there are responses to all of these arguments. We are working all the time to address letters to the editor that appear in papers. We're on panels, on the other side of these folks. And so there are good and credible responses to each one of these arguments. And I'll talk about their relative sort of how they resonate with lawmakers. So one of the first arguments is that suicide is wrong and that it's something that the legislature should be working to discourage rather than encourage. And so if any of you have heard us talk about this before, our position of correcting people when they talk about assisted suicide and talking about medical aid in dying is not just rhetorical. It's not rhetorical at all. In fact, people who are suicidal would rather die than live. And our supporters and people who would use medical aid in dying, people who've accessed it in states where it's authorized, are people who desperately want to live, but the disease is killing them, and they want a more peaceful end. And so to talk about this as suicide is is flawed from that perspective, and it's deeply hurtful to people who've actually, sought aid in dying. So we try to emphasize the fact that not only does this not encourage suicide, it isn't suicide at all. We have a lot of messaging on that, which I'll share with you in a little while, what resources we have on that issue. Another argument that our opponents make is that we have hospice and palliative care and that we ought to be paying attention to those options. In fact, our organization, many of our allies have long been supporters of increasing access to hospice and palliative care, and hospice and palliative care have provided relief to countless thousands of people in New York State. What we've seen in states that allow for medical aid in dying is that access to hospice and palliative care and the quality of those services has actually improved. And so this is not an either or. We're not saying that we either focus on hospice and palliative care or medical aid in dying. Many individual hospice providers and palliative medicine providers recognize that medical aid in dying is just one tool in a comprehensive plan for end-of-life care. And so the argument that hospice and palliative care, is what we should be looking at, while that's true, we also need to add this additional option. And the fact is that for some people, even the best hospice and palliative care doesn't relieve all pain and suffering. And that's why a small number of people in authorized states have accessed medical aid in dying. I think the argument that resonates the most with lawmakers is that this bill, this approach, medical aid in dying, is a danger to vulnerable people. We've seen this argument repeated in a number of ways. There was just an article in a letter to the editor in Newsday this morning about this. And our opponents have probably a dozen names that they use on a nationwide basis to prove that there are problems with the Oregon law. Compassion and Choices has done research on every single one of those cases, and none of them, I repeat that, have anything to do with dangers of aid in dying. Each one of them has a backstory to tell. And so if you ever see the list of names of people who've been harmed by the Oregon law, we have resources that can help explain what each of those cases are. But even in the case of the Newsday article, neither of those cases were situations that were harmed by Oregon's aid in dying law. So there have been 2 decades of research. These laws have been under a microscope, and there's no evidence that there has ever been a case of abuse, coercion, or misuse of an aid in dying law. The Disability Rights Oregon, which is the group that safeguards the rights of Oregonians with disabilities, has issued a letter year after year saying that there has not been a single instance of misuse of Oregon's law. So there's evidence out there, but for some lawmakers, we've even had a lawmaker say, I've seen all of that evidence, but I know human nature. And I know that this is a possibility. And so it's a powerful argument. It's what I've called sort of using the politics of fear to get good people to say no to a bill like this. Another argument is that doctors are often wrong about prognoses. And that's another argument that was repeated in the letter to the editor just today in Newsday. And it's true, doctors are wrong all the time, but they're wrong more often than not in overestimating the time that people have to live. If you know anything about getting people into hospice, more often than not, people are referred to hospice way too late to get any benefit from it. The vast majority of people are given more time and then are caught scrambling at the end to access services because their doctor was so reluctant to give them a 6-month prognosis. But there are also people who outlive that prognosis, and sometimes with good hospice care, people really do outlive their prognoses because their care is more coordinated when they get to that position. So there are things that we can say about each. I've reviewed these in very brief detail, but we've got a more in-depth training that we give to advocates. The next one that we'll be holding, as Amanda said, is December 7th. I just put religious arguments here in parentheses because we've seen, even in publications like the Catholic Register, we've seen even spokespeople for the New York State Catholic Conference admit that religious arguments do not resonate with New Yorkers. The fact that somebody may be opposed to medical aid in dying because of their religion, the answer to that is, once this law passes, nothing changes for people who don't believe in medical aid in dying. If you don't request it, this law will never affect you. So I'm going to stop here and ask if anyone has any questions before we move on.
Yes. Are there any physician groups that oppose or other healthcare professionals?
Well, the American Medical Association has long had a position of opposition against medical aid in dying, but about a year and a half ago, they decided to re-examine that position, and they've been in a very long process of studying and debating and looking to states to figure out, where they are. Actually, isn't our next slide? Yes, it is. Amanda, are there any other questions, or maybe I should just go on to this next slide, which seems to address that question?
There is, Gail wants to know if there's anything written about how positive this is for families to be together at the end, especially families of a distance, and Jewish folks that bury on the next day.
Oh, there's nothing that would interfere with people of a Jewish faith in next day burial. There's nothing that would change or impede that religious tradition.
Can you hear me?
Yeah.
So no, I'm thinking of this my own personal experience, but you go to visit someone who's terminally ill, and you may return back to your home a distance away, only to find out that without them being able to plan when the end is, that they've died, and you have to turn around and come back the next day for a funeral. And I think that there's an aspect of this that could appeal to so many people to say, this is so beneficial for families who come together from a far distance to be with a loved one, to be able to say, we're together at the time of passing. And for Jews who must bury the next day within most reasonable opportunities, it is an improvement. So I was actually thinking about writing an op-ed to that effect. And I just wondered if there was anything from that perspective already done.
Gail, that's really beautiful. I'm glad you mentioned that. I don't think anyone has said it that clearly and directly before. I will share with you an article that delves into the experiences of families in Oregon and looks at the mental health aspects of medical aid in dying and the effect on the family. It's quite a good article, and we've not had anyone reference it in any kind of a public way. We use it to respond to questions around aid in dying, but it might help you in crafting this op-ed. I mean, I have to say, I think it would be very powerful. There are some members of the legislature, people of Jewish faith and of Catholic faith, who have some concerns around this, and I think that your opinion piece would be really persuasive. The only other thing to mention is that there's a lot of anecdotal evidence out there about how families have really come together to wish, to say goodbye to people. There was a great piece in the New York Times several months ago about a man from Vancouver. It was a gorgeous story about the gathering of his family and friends. And we keep seeing stories coming out of California, but no one's put it into words here in New York.
Well, I could use some help with it. I'm feeling pretty strongly about this. I think every day when I read the local papers, obituaries, I have such a nice warm feeling when it says person died surrounded by their loved ones, no matter what the cause may have been, and what that really does in terms of a family dynamic. So that's the tact I'd like to take, and maybe just change some of this discourse.
Well, I love it, and we'll be happy to work with you as much or as little as you want. So we'll be in touch after the webinar.
Okay, and that is, me personally, I mean, our organization supports the concept. That's me personally saying I'll put my name out there on that.
I figured. That's great. Okay, Amanda, are there other questions, or should I move on to try to address that first question with the next slide?
Yep, I would move on to the next slide.
Okay. So we often get the question, where do professional health groups stand? I have just listed out the New York groups here, but since the person who asked the question asked about medical groups, I will say that like I said before, the AMA is now studying its longstanding opposition to medical aid in dying, and they're looking to the states. So we worked very closely with a number of physicians here in New York, and the Medical Society of the state of New York voted in April to survey its members this fall on their attitudes towards medical aid in dying. When we delivered that news to lawmakers, it created a lot of interest. Lawmakers really want to know where MSNY stands on this issue, and so do we. If the poll goes the way that we think it will, based on what we've seen in other states, we're going to see the physicians from the Medical Society indicating their support. Amanda and I have been traveling around the state talking to doctors, and while we get grilled by doctors about the law, at the end of the day, most of them that we've talked to in their formal and informal settings have indicated support. So we have high hopes for this poll, but we'll see. I don't think it's gone out yet, and we will certainly let this group know once that survey comes out. I mean, everyone will know because we'll be putting out a massive press release if it comes out the way that we think it will. The Hospice and Palliative Care Association of the state of New York has an official position opposed to medical aid in dying, but that group too is looking into their own position on this. It was part of their lobby day 2 years ago, part of their legislative agenda to oppose medical aid in dying. It was not part of their agenda last year. So we are looking forward to a 2018 where we can count Hippocanes as a partner, but we'll see. We're doing a lot of work to make that happen. Hospice and palliative care groups across the country have started signifying their support for medical aid in dying, and we hope that New York follows in that tradition. We've been doing a lot of work to reach out to the nurses. Neither the New York State Nurses Association or the American Nurses Association, the New York chapter, or the New York State Psychological Association has yet taken a position on this bill, but those are some other groups that lawmakers pay close attention to. So we're doing a lot of work to make that happen. Are there any questions here, Amanda?
No.
Okay. But in terms of professional healthcare groups, I just want to remind you that when we talk about supporters, we've got the New York State Academy of Family Physicians and the New York State Public Health Association that support the bill.
A question if AARP has come out in support.
No. Amanda has given presentations to AARP chapters. I've been in touch with their state legislative director, but I don't think that AARP is going to take a position. And, I can understand why. When the Affordable Care Act was being debated, the AARP took a position. It was a wildly controversial bill, and they lost quite a few members when they took a position in favor of the Affordable Care Act. And so I think that for organizations that are membership organizations, they risk losing a chunk of their membership when they take a position on a controversial bill. And while this shouldn't be controversial, when you look at the polls, it actually is for some of these groups. And so I don't expect that the national AARP is going to take a position. I think that the state will follow the national and refrain from taking a position. But I know that individual AARP chapters and members have been supportive and have wanted us to come out and do presentations. So wherever and whenever we have the opportunity to talk to AARP members, we are there.
There's a question about why hospice is opposed.
Well, it's a good question. And when we are on a panel with hospice and palliative care representatives, we ask the same question. In fact, many hospice providers and folks who sit at the bedside recognize how often people ask for help in dying, and what a gap this law would fill. Hospice, in its memo of opposition to the bill, cites the fact that New York is pretty low on the scale of people accessing hospice and palliative care. So many eligible for hospice in New York through Medicaid, Medicare are not seeking it. And so what their emphasis has been is in trying to improve accessibility and get more people to opt for hospice and palliative care. I think why you hear the voice is because I constantly try to say that once we pass a medical aid in dying law, more people start to talk about what they want at the end of life. And naturally what happens is that people start to understand more about what hospice and palliative care are, and they seek out those services. Certainly one of the things that we've been doing with our campaign is talking to communities about what options already exist for end-of-life care. And so as an organization, we've been promoting people accessing those services. End of Life Choices New York and Compassionate Choices spearheaded the Hospice and Palliative Care Information Act. So we're firmly committed to making sure that those numbers, get better. But it's not by opposing medical aid in dying. That's our position. So I don't know if that's a satisfactory answer, but I don't know that there is a satisfactory answer.
This is Amanda. I'll just add to your point, Corinne. I was recently on a discussion with the director of member services for the Hospice and Palliative Care Association of New York. And when a member of the audience asked that specific question, she didn't give a straight answer. She just said that they believe their efforts and their time is better spent focusing on exactly what Corinne mentioned, trying to make hospice better, not trying to advocate for a different law. So that's the explanation that I've heard directly from hospice. And then there's just one more question. Have we connected to the New York chapter of National Association of Social Workers?
We have. And they were appreciative, but because they don't have a formal role in the bill as either the professional that can provide the mental health assessment or in a prescribing role or any other official role, they declined to take a position. So they are not opposed, but they have not yet indicated support. Now, I will say that the National Association of Social Workers has a position of what they call engaged neutrality, which is actually quite a good position, meaning that, it really is the decision of the patient in consultation with their doctor and their family. And I've heard that there is some reorganization of the statewide chapters of NASW, and we've met with a couple of those people recently. We're going to be going back to NASW New York chapter to see if they'll reconsider their declining to take a position. They mirror the engaged neutrality that their national organization has.
All right, Corinne, go ahead and move on.
Great. So we're going to talk now about the impact of the September 2017 New York State Court of Appeals decision. And I just want to say that David Levin, who is the Executive Director Emeritus at End of Life Choices New York, is also on the call. And so I'm going to go over these slides. But David, if you have anything to add or comment, please feel free to do that. So why do I have a breaking news thing up here? Does anybody else get these things? I hope maybe you don't even see it, but I don't need to know that the Republican tax overhaul efforts happened. Okay. Okay, so 3 terminally ill plaintiffs and doctors filed a lawsuit in February of 2015 seeking to establish the right of competent terminally ill patients to aid in dying under the New York State Constitution. Just this past September, the Court of Appeals upheld the lower court's dismissal of the suit, finding that there was no fundamental right to aid in dying in the state constitution, and emphasizing that the legislature had a rational basis to criminalize assisted suicide. The ruling was unanimous, and the court issued an 81-page decision. The majority opinion was 14 pages. It was quite straightforward, but it was accompanied by what I thought were three very interesting concurrences. Justice Fahey focused on the slippery slope argument that, once we get medical aid in dying, it would be expanded to look more like the European model, and then focused on sort of a litany of horrors coming out of aid in dying in Belgium and the Netherlands. Justice Garcia focused on opposition from MISNY, Hipkanes, and a 1994 task force on life and the law, which was issued before any state had implemented an aid in dying law here in New York, and was full of hypothetical fears about aid in dying, none of which have materialized. And then Justice Rivera, which I thought was the most interesting concurrence, tackled the substance and concluded that the plaintiff's claims are better addressed to the legislature. So our position really is that the Court of Appeals decision in Myers v. Schneiderman leaves us in the same place we were before the decision, that it's up to the New York State Legislature to authorize medical aid in dying. We had hoped that that was sort of the, what the takeaway was from that decision, but of course we've had papers across the state take different positions. Some of them agree and have underlined the fact that now the ball is in the legislature's court and the legislature needs to act. And some of those newspapers have called on the legislature to do so. And there are other journalists and reports that sort of suggest that this puts us in a worse position, and that the legislature didn't just have a rational basis for suicide, but continues to have that rational basis. So our work remains the same in showing that there's been a tremendous amount of evidence and that there's momentum among professional healthcare associations. So I'll leave it there and see if David has anything to add, or if anyone has any questions. Anything, Amanda?
Nope, I don't see any questions.
Okay, so we'll move on here. Yes.
What is the aid litany of horrors in Belgium and the Netherlands?
Well, you'd have to look at the decision, the Justice Fahey's decision, but basically Belgium and the Netherlands have more expansive aid in dying laws that allow people who are not terminally ill to access, and quite a bit of emphasis was placed on the fact that people who are dissatisfied with the quality of their lives in places like Belgium and the Netherlands are able to access medical aid in dying, and what they should be getting is mental health care. So, if you actually familiarize yourself with the laws in Belgium and the Netherlands, while it is true that the eligibility criteria are very different from the model here in the U.S. based on Oregon's law, and all of our states follow Oregon's law and not anything like what they do in Europe. But if you really studied access to medical aid in dying, even with the expanded eligibility criteria, there is no real litany of horrors. It's not as easy to access aid in dying in those places as one might think if you read the opposition arguments. So I sort of shouldn't have maybe said litany of horrors in a facetious way, because some people take quite seriously that there are horrors there, but really if you look at the research, there's not. But that's what the opinion looks like.
All right, go ahead.
Okay. So what to expect in 2018. We're going to talk about three different aspects here: what to expect from the legislature, what to expect from our opposition, and what to expect from CNC. And so I'll start and let you know that, as most of you on the phone know, the legislature returns for a second year of its 2-year cycle in January 2018. We know that discussions are happening among lawmakers in small groups, but also there may be more organized discussions among the Democratic Conference around aid in dying. So those are happening. Plans for those things are happening all the time. The first stop for this bill will be the Assembly Health Committee, and the composition of that committee is such that It's not an easy passage, and we'll need to do quite a bit of work to move that bill through the Health Committee. At the same time, we've sort of got our eye on the entire assembly. So our targets are really people who still have questions about the legislation and are undecided, and we're doing in-district meetings with those lawmakers to move them into a supportive or even a sponsor position. But we still have to focus on trying to get the bill through the Assembly Health Committee. We also have been trying to encourage the legislature to hold public hearings on this bill. It's one of the critiques that we've gotten from lawmakers is that there really needs to be a public hearing. And so working with some of our allies and some influential statewide organizations, we've been trying to persuade both the Assembly and Senate Health Committee chairs to hold public hearings on this issue. And that's going to be a major focus of our work over the next couple of months. So if your organization can help with that, we certainly could use the help. What to expect in 2018 from the opposition? I think we'll see stepped up efforts by the New York State Catholic Conference, New Yorkers for Constitutional Freedoms, and the New York State Alliance Against Assisted Suicide. Some of you may have seen that there was a billboard placed outside of, I think it was on Route 787 in the Capital Region outside the Capitol, opposing medical aid in dying. I actually drove past there yesterday and I didn't see it. Maybe I just missed it, but I thought I looked for it and didn't see it. So
It's gone.
I think it's gone. Yeah. But I think we'll see more of that. I don't think, I think that kind of stuff is only going to increase. I think we'll see increased expenditures by opposition groups, an increased presence of visible opponents in Albany. And all of this is because I think we're making progress. And when we saw the billboard erected on 787, we thought, well, we must be making some kind of an impact, because when the opposition starts spending money, that means that they're taking you more seriously. So anytime this happens, it's a counter to the progress that we've made. Well, I think we're also going to see new arguments by our opponents, an emphasis on scare tactics, which we're already seeing. And also the use of the federal effort to repeal the Affordable Care Act and all of the efforts that the federal government is undergoing to eviscerate the Affordable Care Act. I think we're going to see those arguments used against medical aid in dying. So in other words, as people have less access to care, it becomes easier to get a terminal diagnosis. And so as people's access to care decreases, their only option may be medical aid in dying. That, of course, is a nonsensical argument. People's access to healthcare may very well lead to death, but the existence of an aid in dying law doesn't make that any better. It's not like opponents of the Affordable Care Act are saying, well, at least we have medical aid in dying. We can feel safe cutting people's health care so long as they have access to a gentle death. That's not what's happening. So we need to be careful in our messaging about how to counter that. And many of us are actually, allies in the fight to preserve affordable health care. So it's going to be a tricky argument to counter. And then finally, I think we'll see a change in tactics, and we may even see civil disobedience from our opponents in Albany, and maybe at any public hearing that we are able to procure on this issue. So that's something that we need to be mindful of. I think the only other thing I'll say about the stepped up efforts of the opposition is that we've been very clear with our supporters at every gathering that we've ever sponsored or held or attended that our movement is based on compassion, and that whenever we encounter the opposition, meet that opposition with compassion. And so our volunteers have been amazing in terms of their friendliness, their sort of loving demeanor with people who oppose us. So even in Albany, when we've had folks opposing us who are lost, our supporters help the opponents get to where they need to go, because we realize that they need to have a voice, and all we can do is present in the way that we want to be seen, which is as compassionate people who simply want people to have options. So I'll leave it there and turn it over to Amanda to talk about what to expect from CNC in 2018, unless there are any questions first.
There's not. David Levin just mentioned that his microphone was not working, so he wanted to encourage people to read Judge Rivera's concurring opinion, which looks like a partial dissent. It's very helpful in addressing a lot of the arguments that the opposition discusses.
Oh, thanks, David. I'm sorry your microphone wasn't working, but I'm glad you added that.
So in 2018, Compassion and Choices is already beginning to plan what that's going to look like. We will be holding a kickoff event in January at the Capitol to welcome back lawmakers. We don't have the final details on that, but once it is officially planned, we will be letting our organizations know. We'll have a consistent lobbying effort as we did last year. As Corinne mentioned, we were able to meet with almost all of the lawmakers last year. So we'll be following up with any folks who are still on the fence or anyone that we have not yet met with. We will have events and meetings in target legislative districts. We've been doing that throughout the summer and the fall, and we'll continue to do that in January. A new thing that we're going to be doing is local resolutions. We're going to be asking city and county municipalities to come out with resolutions in favor of medical aid in dying. So our action teams and supporters across the state will be participating in that. And of course, it would be great to have our organizations participate. We'll be sending out online actions, whether it's a petition signature, an email into a lawmaker, those sorts of things will be popping up at key times throughout the legislative session. And then, of course, we will be hosting our annual Spring Lobby Day in May, sometime of 2018.
I didn't realize the slide was here, but I guess I'll jump in and say that we've got a lot of new resources for people. We've developed these fact sheets in response to some of the frequently asked questions from lawmakers. So these are available if you want them. We'll certainly be using them in our packets this year. The one on the left is about physician support for medical aid in dying. The one in the middle is about all of the reasons why medical aid in dying is not suicide or assisted suicide. And then on the right, you see 8 facts about medical aid in dying that are the most cogent ones that people always want to see. So those fact sheets are available to people. Amanda, do you want to go over the upcoming events?
Sure. So on November 2nd, Corinne and I will be in Brooklyn at a nice restaurant called the Douglas to celebrate a Day of the Dead, or Dia de los Muertos. We had an event last year and we were able to get quite a bit of Latino press and media there. This year it's going to be a little bit different. We're offering our supporters the opportunity to come and remember their loved ones, light a candle, and then we'll talk about medical aid in dying and how folks can get involved. So this is really a cultural celebration that Corinne and I are really excited to hopefully be able to make some friends in the Brooklyn area and grow our base that way. On November 14th, we'll be in Buffalo at Evergreen Commons to do a presentation that we have been wanting to do but have not yet had the opportunity. It's going to be Wishes and Values at Life's End, and we're going to be discussing advanced care directives and options at the end of life, and then we'll also discuss medical aid in dying, but this will be a much more broader presentation, and we're partnering with Evergreen Commons in Buffalo, who has really great connections, and I was recently informed by a physician in the area that they do a lot of good for the community. So we're really excited to be partnering with them in November out in Buffalo. On December 6th, we're doing a presentation at the Brooklyn Borough Hall. We have Reverend Johnny Green, Corinne Carey, our physician advisor, Dr. Pratt, as well as a supporter who lost her husband, an NYU professor, Yusuf Cohen. They're all going to be speaking that evening in Brooklyn to talk about medical aid in dying as well. And then on December 7th, we're going to be hosting an advocacy training for our supporters in Brooklyn as well.
Do you do anything during the day? Because these all seem to be evening things, and I just want to point out that a lot of volunteer advocates, particularly seniors, are much more likely to come out to something during daylight hours.
Gail, yes, we've actually experimented with daytime and evening ones. These events in particular are ones that happen in the evening, but we've done afternoons in Ithaca. Whenever we're working with a partner, we try to ask them what the best timing is. And so for Evergreen Commons, we spoke with them a lot about this issue, and their recommendation was to do an evening event. But
yeah, thank you. I don't mean for you to be defensive about it. I was just asking if that's an opportunity in the future.
No,
so the answer is yes. Okay, thanks.
Always. Yep.
Correct. Laura Kelly just reminded me, we're doing a screening of How to Die in Oregon with a discussion afterwards at the Mount Kisco Public Library on Saturday, November 18th, and that event is going to be at 12:30. So that one will be during the day.
Yeah, Laura, thank you so much. We've left that one off this list. Sorry about that. All right, so we are running over already, so I just want to mention that our key messages in 2018 are that New Yorkers deserve the same end-of-life options that people in 6 other states plus the District of Columbia now have. Another key message is that the experience of states that have recently adopted medical aid in dying laws reinforce what we've known for 2 decades, that medical aid in dying is an option used by relatively few people, but provides comfort to countless others. There have been no cases of misuse or coercion, and adding the option improves end-of-life care for everyone. Finally, lawmakers should take action on the medical aid in dying before facing voting polls in 2018. So those are our 3 key messages for this year. And finally, and I hope that people can stay on the phone for at least another 3 or 4 minutes, what can supportive organizations do? Amanda, can you take this away?
I certainly can. So you can inform your constituencies and supporters of upcoming events. So as Corinne mentioned, going forward, each time that we have a new event on the calendar, I will be sending out an email to you to let you know what's happening and give you all the details. So you can always send that out to your folks. You can write a letter to the Assembly and Senate Health Committee chairs, encouraging them to hold a hearing. As Corinne mentioned, it's something that we're really working hard to convince them to do. And the more they hear from other organizations and stakeholders how important it is, the more apt they are to listen. You can help connect us to other organizations that might be willing to endorse. Organizations that you frequently work with might be interested in this issue as well. You can attend our January 2018 kickoff event, and as soon as those details are finalized, we'll be sure to get you out that information. You can partner with us on events that encourage public dialogue, similar to the one that we're doing out in Buffalo. People often ask if Corinne and I have a speaker's fee or, what's required. If you're willing to help us get a presentation off the ground, there's no cost to you. We just look for spaces and venues where we're able to do that. And so we're more than willing to always travel across the state and do that. And the last one kind of goes along with that. Help us locate space and co-host our events.
But there's more.
There's more. You can testify at and bring supporters to any public hearings once they're scheduled. You can help us identify allies for passing local resolutions in support of aid in dying. As I mentioned before, this is something new that New York is going to be taking on. We've heard from folks in California that passing these resolutions were extremely instrumental in California. And so we really want to get that off the ground in New York. So any help with that is greatly appreciated. You can issue a memo of support. You can encourage your constituencies and supporters to take action. If you want to circulate an email, we have a petition online that is easy for people to sign, and they can also send emails to lawmakers. Again, we have that electronically, a very easy action to take. You can accompany us on lobby visits in Albany as well as at in-district meetings. We've been planning our in-district meetings throughout the fall, and we'd love to have more folks attend these. And you can join us on our spring lobby day. One of the things that we did last year was our first time doing it. We were able to get a bus from New York City. We had about 20 people on it. I would love to fill a large bus this year, and we're willing to work with our organizations to help make that happen.
Great. So I don't want to take up any more of your time. I just want to let you know that we have frequent campaign updates and interesting stuff and things that are going on our Facebook page. We tweet, not as often as we should, but we try, at Comp and Choices New York. You can follow us on Twitter. And we have a state landing page where you can find all of our upcoming events, campaign updates, current calls to action, and other information at that compassionatechoices.org/New York website. And finally, if you ever have any questions or concerns or thoughts, you can always reach Amanda or I at these emails and phone numbers. Thank everyone for staying on the phone a little bit longer and listening to all of this. I look forward to working with you all in the future, and I hope to see you all in Albany soon. Amanda, are there any other questions, or do you just want to wish everyone a great weekend?
No, I thank you all for attending. As Corinne mentioned, we are both always available. There aren't any other questions, but I really appreciate you guys taking the time this morning, and I look forward to working with you more in the future.
Great. We can end the webinar. Terrific. Thank you, Amanda.